All right, welcome back in. Now, when you think of indigestion, it might have come from downing a huge taco for dinner or, say, even lunch. But if you're feeling the burn after a morning cup of coffee or in the middle of the night, it might be something that's called acid reflux. A gastroenterologist, Dr. Michael Passarella, joining us now from Shelby Gastro. How you doing, Doc?
I'm doing great. How are you doing, Sheldon?
I'm doing fantastic. So everybody wants to know, first off, what is acid reflux?
Well, it's a very common condition that really affects everyone at some point in time, but generally referred to by most as heartburn, I think, since that's the most common symptom. But, you know, the stomach and the body make acid, naturally to help with digestion. And acid reflux is when the acid from the stomach literally backs up or refluxes into the esophagus or the food tube, where it's not really supposed to be, which causes the symptoms that we experience when we have acid reflux.
Yeah, and so what are some of those symptoms that come along with acid reflux?
The most common is routine heartburn. You can have bloating in your abdomen. You can have abdominal discomfort or sometimes even pain in the abdomen. You can have unusual chest pain that sometimes can be mistaken for pain from the heart. Some more unusual symptoms might be cough or having to clear your throat, and sometimes even having trouble swallowing can be related to acid reflux as well.
Now, is there anything, Doc, that I can do to maybe ease some of those symptoms or help in that?
Absolutely. The first thing that we talk to patients about is really, modifying our lifestyle and how we eat. So, it's important to avoid some of the foods that can trigger acid reflux. And that can be just about anything, really, for some of us. There are more common ones like, chocolate, alcohol, a number of things that we can eat that can trigger that, acid reflux. And so if you can identify those triggers and minimize or try to stay away from those triggers, obviously you'll do better. Also, we talk about portion size in terms of how much we eat, trying to limit our portion size, eat smaller portions. And then a lot of times acid reflux and heartburn can affect us at night and in the evening after dinner, especially when we lay down. And so if we can modify maybe the time we eat dinner to eat an earlier dinner to give ourselves more of a gap before we lay down. And then again, eating a smaller portion size at dinner is really important as well.
I'm going to I just got to ask, does stress have anything to do with this or at all? Can it play into it?
Stress can, I think, cause symptoms that can mimic acid reflux and pain in the chest and heartburn. Whether it's truly related to the acid is a harder question to answer. But certainly, stress in general can cause some of the same symptoms. Yeah.
So what kind of treatments are out there to deal with acid reflux?
Well, we've got great medication options. And so, and I think most people are probably familiar with many of them over the counter, things like Tums and Rolaids. You can, buy something like Pepcid as well over the counter that are all fast acting and can provide relief for a usually shorter period of time. But there are some great prescription medications too. And now that you can actually buy many of those over the counter, like Prilosec and Nexium and those types of medications, which really don't act as quickly, so they're not as good a medicine to take if you need some relief quickly, but they can really get your symptoms under control over a period of time, and they act for a longer period of time. So there's some great medication options out there if the other things that I mentioned in terms of lifestyle modification and dietary modification don't work.
And of course, if it becomes too severe, we do recommend that everybody go see their gastroenterologist and deal with the acid reflux as best they can through some sort of treatment. Hey, thanks, Doc. We certainly do appreciate you.
Absolutely. Thanks for having me on. Good to see you.
All right. Good seeing you, Dr. Michael Passarella right there. All right. Coming up, we